when it comes to addiction, what are the symptoms or signs to look out for? What are some of the things that will stand out for you to know that, oh, this person I am interacting with, or this brother, this sister, is an addict or is addicted to drug substance?
Yes, so you will have the issue of the craving, the desire for that particular substance, or the desire for that particular behavior. You see, I'm using two constructs here, a substance and a behavior, because it may not just be a drug that the individual is addicted, it could be a behavior. That particular risky behavior, that particular gambling behavior, people get addicted to pornography, they get addicted to gaming and all those things. So all these things have a way. So the craving. So every day you want to have it. You want to get yourself indulged in that particular activity. And as young ones for who we are dealing, our target is actually focusing on, then you begin to see the performance in school will begin to drop. And this was a good student who did very well as regards his grades and his performance in class. All of a sudden, there is a decline in his performance. Then become difficulties engaging in his usual social life. Because that particular, so this the young man that was all over engaging social and more effective in his social life, but these days become very difficult. Then energy, the individual may lack the energy to even engage in a lot of activity. A reason why a lot of them will isolate and just want to be in this particular behavior, necessarily not doing anything. Sometimes the energy within them is not there to even engage in anything positive within society. Then they appear defensive. They appear defensive in the sense that when you see them, you want to point out something you have seen. They are ready to give you a reason why you should even believe what you think is the right thing. Some of them become manipulative. Because when they get addicted and they need to keep using that particular substance continuously and they do not have the resources to continue, you see that they'll call one friend here, call another friend here, and they keep giving you stories that you should believe, and so they are a bit manipulated in order to be able to gain what they want, to be able to access the particular substance or behavior that they have indulged themselves in. Okay. So these are about some of the signs, the symptoms of addiction.
Okay. So now let's talk about management. Someone is an addict. Where do we start from?
Yes, and if you look at managing addiction or managing any substance use, it begins with the individual. You, the person who is in that challenge, need to be convinced that I need to take a step. Beyond that individual, people around him, his social surrounding, need to be able to provide him the support. But first of all, I must be willing, ready to take up the step. And that is when you can make up the move. So when the individual is ready to take up the step, then the social support can come in, family can come in, the institutions can come in. But first, the individual must be convinced that I am in a situation that I think I need help. I have found myself in a very challenging circumstances, and I think that I am convinced that this is affecting me socially, affecting me emotionally, affecting me psychologically, affecting me physically, and so I need to take a step. So when the person is convinced like this, then the other environment, the enable environment is created. So it means the health facilities available, the personnel available, the resources needed to help this person, the individual will do well. So first is the conviction that I need to get out of this behavior. If you don't have that conviction, no matter the best expertise you find, psychiatrist, psychologist, whatever, the person will not do well. Because if you go to sit before the psychologist, I normally would say that the work of the psychologist, as you will see, he does so many things in one. So his job is not like he has seen you for 20 minutes and so he asks you to go and buy a medication and then you go. Yeah. The psychologist sits with you for an hour or so, and everything that you should have probably gone to the drugstores to buy, he will, because what he does is psychotherapy. Yeah. So he will do everything within that setting. So if you leave that particular environment and you do not pay any attention to what you discussed, then it is not like something he can actually force you to take, but he's convincing you, he's helping you reconstruct your thinking to come to believe that, I have found myself in a difficult way, and one of the ways to get out of it is pay attention to what is happening, pay attention to what I have been told, and follow it. Because sometimes it may just mean behavioral modification, dealing with the friends that you have, dealing with your thinking pattern. What is it? What do you derive from this particular substance? If you come to appraise yourself to this level, then you think that, this particular substance is causing me A, B, C, D. Am I ready for the consequences? Then you'll be more willing to undertake this particular process of dealing with the addiction. But if the individual who has found himself in the addictive behavior is not convinced, no matter the best of medical equipment, no matter the best of medical personnel, it will be challenging.
Okay.
To be challenging.
So let's to take you back. Let's talk about withdrawal symptoms.
Yes.
I hear that when addicts decide that to take the road to recovery, they get withdrawal symptoms.
Yes.
What is withdrawal symptoms?
So, thank you. Withdrawal symptoms these are symptoms that an individual begin to experience when they decide that a particular behavior which I have indulged myself, a particular substance that I have been taking, I want to get rid of it. And the substance that you have been taking have been maintaining you at a certain equilibrium level. Yeah. So when you then decide that I am not going to take that substance, you can be sure there will be some implication. So that issue of wake up and you have tremors, let's say you hold things and it's almost falling. Some individuals are not able to concentrate. They have some weird behavior put up. So withdrawal symptoms simply have to do with experiences that addicts undergo when the substance that they are using or the behavior that they are engaging is kind of curtailed or trying to stop it. And so they are not getting that fulfillment. And so at a point, they feel uncomfortable, they feel uneasy, so the nervous system begin to react in such a way that they are unable to control. And physically, you will see some of them just shaking like this because of, and sometimes in their behavior, in their way of thinking, is being impacted.
Okay, so let's backtrack.
Yeah.
Last week we were talking about substance abuse, and now that we have you in the building, I think that you are the right person to throw more light on this particular issue. How quickly can someone be an addict?
Yeah, so in actual fact, the time frame varies. Different books will talk about different, so different literature will talk about different things. But the bottom line is that even if it means a day, or 2 or 3, or in a month, and you are in a particular substance or you are using a particular substance, but that particular substance is affecting you physically and psychologically, then we say you need to be cautious, because process of addiction is something you are getting into. So that's why if you look at a lot of literature, they are unable to hold on to one particular thing. Some people give you, but they give you a background as to why they are saying this. So if you don't have that background, sometimes it's a bit challenging. But you just get to know, appreciate that once you are using a substance and the impact is on you physically and psychologically, then you are getting addicted to that particular substance.
Okay. So are there effective addiction treatments? Because sometimes I think that we like to think that when people become addicts, that is almost like the end for them.
Yeah.
And you know how people keep saying when someone is an addict, there isn't really much you can do for them because they are far gone and all of that. Are there effective treatments for addiction?
Yes.
There is.
There are effective treatment regimen for addiction. We have found ourselves in a situation where when we say yes, people are asking you where are the places.
Yeah.
And that's where the challenge is. But there are a lot of good rehab centers. that when you send somebody who has been addicted to either alcohol, marijuana, cocaine, or something, these other individuals are able to come out neat and can contribute to society. Yes, when I say in Ghana we have a number of them. Unfortunately, or should I say fortunately we have some, but unfortunately not in this part of our country. So you will find them in the southern part. So what Total Life Enhancement Center seek to do in the northern part is to bridge this gap. So even though we do not have a well-established rehab center, but we're able to support people and provide the day in, day out OPD basis services for individuals so that they are able. So that, when we are initiating that, we want a family member, an enabler in the family who can be of support, and that is when these things do well. And I can say in the past 5 years, we have been able to, not less than 10 people have passed through our hands and have done well. Each of them keep calling and they're like, we keep giving your numbers to people and say, well, we're waiting for them. And so there is that, it is there, treatment centers are there, only that in the northern part of Ghana is challenging, but in the southern part we have some. What Tolek is just doing in the northern part is the OPD basis. We are not able to keep people in-house. Yeah. The other aspect of the treatment which is challenging is the ability to afford. It's actually costly to do rehab.
Okay.
Very, very costly. So when you go to some of the institutions, you'll pay so much, and that is where a lot of people are shunning from. But at least you pay so much for a service that you are sure will work. And that's why we are encouraging people. If you have a relative who has this challenge, please do. And no, we're talking about the management. I will give you one aspect where the individual is willing.
Yes.
But beyond the willingness, we know there are medications that works. And see, when I say medication, some people are like, but you're a psychologist, you're talking about medication. The psychologist has been trained in a model called the biopsychosocial model. We understand biologically some constraints could be there that can lead to addiction. Socially, psychologically, and the individual environment, all this play a role. So if it is anything that has to do with neurotransmitters, chemicals in the system, they are medications. If it has to do with the psychological aspect of the individual, the thinking, the behavior that are acquired within the environment, the social setting, culture and all that, that is where the psychologists come in. And that forms a greater part of what the psychologist is supposed to be doing. So we have medication. So that's where the psychiatrists then come to also help. You go to the psychiatric hospital and you can have some help. So as of now, the advocacy with the Mental Health Act is that every institution have what is termed a mental health corner. And so, and currently there is a specialization ongoing in the Ghana College of Nurses and Midwives has to do with addiction nursing. So these people are going to come out as addiction specialists, and their purpose is to be able to assist. So it simply means that we expect to get, especially the regional hospital, the teaching hospital, and some district hospital having addiction corners to be able to deal with it. And so when you move from the person's willingness to the medication, then we come to the aspect of psychotherapy, behavioral modification, and that is the aspect that Tolek is actually championing, and a lot of people are benefiting. So psychotherapy and behavioral modification will do a lot, because at the end of the day, even if the person takes the medication, whatever the chemicals are, the social influences are there, the culture is there. Because if you look at it, how do people come to get used to some of this stuff? It is because of friends, peer pressure, culture related issue, marriage, fitness and all this, and people get used to some of these things, and they come to the point of unable to stop, and where they leads them to the addiction. And so at that point, you will need the behavioral modification to deal with.
Okay, so if you just joined us, this is Subsign TV, and today our conversation is around tackling addiction. So you can share this video and also leave your comments and your questions in the comment section. We have Mr. Peter from Tolek Ghana, psychologist, here in the studios today to join us do the discussion. So back to you, Mr. Peter. We were talking about behavioral modification. What exactly does it entail?
Okay. So for whatever situation that an individual will find himself, it is because he has learned and continue to learn. And so individuals in the area of learning theory, like Bandura and his friends, will talk about what the individual sees in the environment, how they are able to model it. So they have learned something, but at the time they were learning it, to them it was a behavior that was appropriate. Or they have learned it, but haven't taken it to a level that is now causing harm to them. So how then do they learn that behavior? So what we try to do is to introduce a concept where the individual is now told as to what to do in order to be able to deal with that particular challenge. So if you think, okay, it is because of my friends in school that I have probably gotten to myself into this particular drug, what do we need to do? Do you really need those friends? If it is yes, how do you and your friends get out of that system? If it is no, there's a point for you to avoid those friends. And so you must consciously put out a behavior so that the point of influence is not there. Is it a TV program? Can you decide that in it you will not watch a channel that contains this? So we are trying to modify. So you consciously decide not to do something, and because you are already taken a different path, we're saying we are modifying that behavior for you, and that is a behavioral modification.
Okay. You also mentioned that an addict needs a psychiatrist.
Yes.
And most often than not, when we hear psychiatrist, we always think that, okay, the person is mad. The person it's only mad people that see psychiatrists. But are addicts mad people?
Not at all.
So why do they need a psychiatrist?
Good. I had mentioned that from the perspective of the biopsychosocial model, there is an understanding that biological construct can lead to challenges, health challenges. One of them being hormones in our system, neurotransmitters in their system, and that is what the psychiatrist study. And who is a psychiatrist? A psychiatrist is a doctor who has specialized in psychiatry. So you can really not be a psychiatrist if you don't have a background in medicine. And so these are people who have studied, and their role as medical practitioners have specialized in that aspect of behavioral medicine, which is psychiatry. So that is their role. So if you come to talk about the fact that they need psychiatry, it is true, but it doesn't simply mean they are mad. It's also our understanding of what mental health is. So as I will always say, when WHO defined mental health over 50 years ago, they talked of the ability of the individual to decide what he or she wants, to be able to cope with the daily stresses of life, to be able to work productively and fruitfully, and be able to contribute to his or her environment. This is mental health. So all that the psychiatrist is coming to do, you realize, no, there is something that is, or you have taken something that has increased the production of some chemicals in your system. So what do? We give you another antidote, or give you a medication that will kind of suppress the production of those chemicals so that you can come to equilibrium. And that is where you will need. For now, as it stands now, I know there are some few Ghanaian psychologists that prescribe, but per the laws of Ghana, a psychologist doesn't prescribe. In other jurisdictions, psychologists do prescribe, but where the training that we have in Ghana as psychologists, we don't prescribe. So if you now need the services of, if you think that you are the addicted person, or the person who has been addicted to a medication that may benefit from some prescription, then you refer to the psychiatrist. And so that collaboration is there between us, psychologists, psychiatrists. I see patients who I think they need medication. I just write for psychiatric consult. They go there, they listen to them, they prescribe the medication, and they say, okay, go back to the psychologist. And so the two of us are teaming up, managing the patient. So he's taking the medication and going through psychotherapy. Not everybody may need that. But if you find people like that, because I will not prescribe per the laws of Ghana, what I will do is to refer you to the psychiatrist who will prescribe medication to kind of reduce the hormonal or the chemicals load within the system, or suppress their production in order for you to be able to engage in the psychotherapy that I will be doing with you as a psychologist.
Oh, okay. So does every addict need to go to rehab, or are there some addictions that can be managed at home?
This is a question that needs you need to look at it in two forms.
Okay.
If the individual has the social support, the environmental support that is needed, yes, he may need to just manage himself at home.
Okay.
Do the thing that he's asked to do. So this individual will need what to term the OPD based services, what Tolek is currently doing. So I mean, natural for those who come to us, it's OPD basis. So you go, you come, and then we just kind of keep rehearsing and keep checking ourselves. Are you keeping up to this behavior? Are you avoiding this particular activity? Are you doing this? That's what we do. But if you realize that if the individual can be able to contain himself within his environment, yes, he could stay at home and do very well without any hospitalization or whatever. But some people, because of the destructive nature of their behavior related to the addiction, they may need to be immediately put in an emergency situation where we try to do detoxification and try to manage certain destructive behavior for a while. Then they may need an inpatient sort of service. And because the rehab most of the time is not located within the immediate environment of the person, fine. So you may want to send the person to an area where he or she will be in-house, take treatment for a while, a month or two, then he could be doing the OPD-based services. But the two possible, but it depends on the preparedness of the immediate environment.
Okay. So, is addiction road to recovery, like tackling addiction, would you describe it as an easy journey?
Sure. Well, it is not an easy journey.
Okay.
I haven't been there, but at least experiential experience tells me that it's not an easy journey. It's not, because to get addicted sometimes it takes fun. It takes just peer pressure. It takes some youthful exuberance to get into it, but to get out of it can be that tough. Very, very tough, to the point where an individual will need all the support that there be to be able to get out of it, because there are certain things you'll be asked not to engage in, but there are things that give you pleasure. How do you do this? And that is where the challenge then comes in. So it is, I mean, I won't describe it as an easy journey. It's a tough one, but tough with desire and with focus, it becomes quite easier. Describing it as easy would simply mean that the individual is willing. But when you find people who haven't arrived, where we talk about acceptance, who haven't accepted the situation in which they find themselves, that can become a very daunting task. But when you find individuals who, at a point of thinking that, okay, I have to, I mean, this thing is quite challenging, it's affecting me, so what do I need to do? I need to accept the challenge, I need to get committed to the challenge, I need to be realistic to myself, which we have a therapy model we call ACT, ACT. Other people will say artemisinin-based combination therapy for the malaria. No, but in psychology it's called acceptance and commitment therapy.
Okay.
So when you come in and I am using this model, I'm simply getting to a point where when you get to accept, there are certain commitment you need to hold yourself onto. Then we can follow the therapeutic process. And within a few months, the individual should walk out and very free and ready to engage his immediate environment in a productive way.
Okay.
So it's possible, but it's quite challenging with individuals who are not ready, but becomes a bit mild for individuals who feel that no, this has caused so much trouble already. What I need to do is to get out of it.
Okay. So what effects does tackling addiction has on the addict's family? What are some of the things they are likely to go through if they have a family member, a friend tackling addiction?
Yes. So when you have a member in your family, one is stigma. Stigma is number one. And stigma is one of the challenges of almost a lot of medical conditions which people don't want to associate themselves to. And when it comes to addiction, it becomes that one of that challenge that also brings a lot of burden. Stigma, why? Because some of those who get used to this belong to prominent families, belong to respectable families in society, and belong to those people who we so hold. I mean, they are not just at the lower level of the social strata, they are high there. So sometimes it's difficult, and that's where the treatment challenge begins, because you're looking at how this individual socially has placed himself and what has happened in his house, they are unable to open up. And that's one of the challenges. So even to really, allow the child or allow that individual go for therapy because of the stigma can be challenging. One of the things is that, I mentioned they are very manipulative. Yeah. You can be sure to pay a lot of, your brother borrowed this amount of money here, your sister borrowed this amount of money, because they're always finding a way to keep up to whatever the challenge is. So as family members, if people know you, what they most of the time will do, this amount of money was sent to your brother, was sent to your son, was sent to your sister, and they have to continue paying debt that they don't know anything about. Shame. The shame of having somebody like this in your house, it can be quite challenging, because some people feel ashamed that they don't even want to identify themselves. So when they are supposed to even go for treatment, nobody wants to follow them. And you see, I initially talked of an enabler in the family. Somebody in the family must be willing to support this person. And so if you don't have that enabler in the family, it can become challenging. So these are some of the challenges that families can, beyond the financial pressure of even taking care of an individual with addiction. These are some of the challenges that family could face within the process of trying to have support an addict in the family, or help somebody who is in their family that has this particular challenge.
Okay. So if an addict recovers, and then I think psychologists, a psychiatrist, everyone signs off that this person is fine. Is there a likelihood of them falling back into addiction? Or like that is just it?
Sure, not. Well, that will not. It's not just like a one-time treatment that you get and it's like it's forever given a guarantee that you will never get this. No, it's like in every medical condition, every health challenge, we will each fall sick, and then they go to the hospital. It is malaria. The following year, if you have not protected yourself well, you will still. So an addict can be in there and get recovered and can come back, and which you call relapse, and that is very even dangerous. That is dangerous, because at the point where an individual is relapsing, whatever the individual went through to reach the point where he has recovered, sometimes they see those things not to work again, and they would have learned different tricks to deal with whatever strategies you gave them. So it becomes challenging when an addict relapses. And so that is where we see when the addict has recovered from addiction, what we need is meaningful engagement. Avoid the shame, avoid the stigma, involve the person, so that this person is more meaningfully engaged with himself, with his immediate environment, and you can be sure this individual will probably not go back. But when the shame, the stigma, and then the person doesn't mean anything in the society again, things like that, it's not better I go back to, because they found joy in wherever they were. So if they come out and then you are not able to support them in a very meaningful way, then they prefer to go back to what they consider is some joyful event in their life, which we all think it is not, but they think it was something good. So they want to go back there. So if you're able to provide them with an enabling environment, it will be very difficult for them to go back. But when the environment is not enabling, relapse is quite possible. Okay. We see people who have gone for rehabilitation, they come back a year or two, then they've relapsed again, and they have to go back. But the cost is where the challenge is.
Okay, so talking about cost, I think, let me ask, do you think that it's one of the things preventing addicts from seeking help? Could that be like a major factor preventing some addicts from seeking help?
Yes, it's among the reasons. Number one is low level of literacy about what the individual have found himself in. If I get malaria today, I know very well that I need to go to the hospital, I need to get tested. If it's positive, I need to take my anti-malaria. But somebody is in the area of addiction doesn't even know that this is an area that has specialists like psychiatrists, psychologists. People don't know. So the literacy is affecting the seeking for help. And that is where the challenge is. And so when we then move on, the individual could have that challenge of being able to get the help that they need, because they don't even know where to get the help. And sometimes the cost, as you mentioned, could be another. I think not putting figures out there, but it's quite it's a bit expensive. One of the facilities I visited in Cape Coast, it wasn't something an average Ghanaian worker will be able to say, I can afford for a brother or a sister every month for 6 months. It will be difficult if you don't get external support and you don't have committed family members. And that is one aspect. So beyond the literacy and knowledge about it, the finances, sometimes the personnel becomes a challenge in dealing with, because some of them invariably will have to deal with a visiting psychologists, visiting psychiatrists, and so in a situation where you have these people in residence and supporting them, they only visit once or twice a week just to assess, and then other people will have to continue, and that may be where the challenges will be. So these are areas. Then you can talk about infrastructure. Really not there. And I want to talk about infrastructure. When you look at the rehab situation, a rehab is not like a place where you can. It's supposed to be a well-ventilated, appropriate place. I saw a rehab somewhere, and if you compare that rehab, it's almost equivalent to some of our hotels in town. A rehab is equivalent to some of our hotels in town, and yet nobody will be ready to provide that as a space for the purpose of rehabilitation. And so infrastructure becomes a challenge. So these are the things that will challenge rehab in the beyond the monetary aspect, which is one of the greatest. But if the person, some people hold money and they don't even have the space. They go in there, the place is full. Maybe the place can only take 20 people because of the capacity of the human resource they have. And so when you come in, they turn you out because they can really not take you and provide you the services that they want to. And that's why I always say that as a health professional, if you cannot relieve the burden of another person, don't add the person burden. And so if I will take you in and cause you more harm, I better ask you to go away. It's better for you to go out and manage the little that you have done, for you to come in, and because of my incompetence, you have acquired other behaviors that you didn't even have before coming in, and that can be quite challenging at that time. Yes.
Okay, so when someone goes through rehab, do you think that are there certain things they need to do to avoid relapsing?
Yeah. So is that to avoid relapsing, whatever substance that you were addicted, and you probably have got resulting in addiction, and you have suffered all the effect and have decided to stay away, you need to distance yourself from it. So be it a medication, be it a behavior, be it a thinking pattern, you need to stay away from it. And that is the way you can probably stay away from that particular, not going back to it.
Okay. So would you advise relocating if someone comes from rehab? Is this something that you would recommend?
Yeah, some environment, change of environment, relocation, it's something that can be on the table, but sometimes can be challenging. So you don't just want to put it on the table like that, and the person, okay, they said I should relocate to where? And that can be quite challenging. But if the person has all the support to move from his immediate environment that was quite influential to whatever that he got himself into another new environment, to begin a new way of living, if that opportunity is there, fine. But not everybody can acquire that or can be able to attain that. But so people who can, we suggest a relocation, a change of environment, sometimes even a change of job, to the point where the individual feels that, okay, if I were working, probably if I work in Tamale and then this has happened, maybe I want to probably think of another environment, maybe the environment itself. But in the rehab setting, you are taught certain techniques, that's in the behavioral aspect of it, as to how to deal, to engage with your environment in such a way that the environment doesn't have so much influence on you to leading you to this particular challenge. But you see, sometimes the addiction is also because of the availability of the resources. So somebody who gets addicted to Petidin may just be because the person has the Petidin around him or her. Every day he sees it. So he uses very often and frequently. So if this person has to be changed from that particular location that that particular drug is frequently available to a place where the person doesn't have access to this, it could also be just the change of the environment or the relocation. So the person happens to find himself in the ward that the Petidin is one of the commonest medication, you could send the person to another ward that this particular medication is not there at all for, so that this person may not even have access to it. Yes.
Okay, so aside relocation, what else can family members do to support someone that is going through rehabilitation or that is tackling addiction?
Yes. So in the behavioral modification or the psychological aspect will be a family therapy, possibly a couple therapy, and then possibly some engagement with some significant others of this individual. So that social support need to be enhanced. This person, so that people, when they indulge in this, sometimes just because they feel that nobody shows them love, so they need love, they need appreciation, they need to be part and parcel of the family. So when you have people who have gone through this challenge, the family support in terms of care, love, support, and encouragement will do a lot for them. Because if they go and come and then you just leave them, once they were there, somebody else kept telling them good things about themselves. So if they come back and nobody seems to be saying these things, they may find it difficult to believe that this is going to work. So we find out that they may end up going back to it. So the family has a role supporting them. Sometimes, even when they come back, even how to maintain their personal hygiene becomes a challenge. So the family members need to encourage in this. Keep on checking on them, supporting them, maybe taking them for some small, a little bit of exercises, a little bit of visiting some friends and all that, so that they can reconnect to people they knew before this challenge happened.
Okay, so if you just joined us, we are talking about tackling addiction, and so far it's been quite a very insightful discussion. I'm really enjoying myself, and I hope you are also enjoying yourself too. So if you have any questions, any contributions, or any suggestions, we still have a few more minutes to go. You can leave them in the comment section, and then our psychologist in studio today can help us address it. Also, I'm giving out my first airtime. As usual, fastest fingers would do what would be able to get it. And if you get it, kindly indicate it in the comment section. Let me know that you got it. And also, I think last week someone got it, but then before I could come to the comments, were already off air. So Cesar Lato Kwamna, thanks for acknowledging that you got the airtime last week. Thank you. So this is Airtel Tigo, and the numbers are as follows: 49 39 62 18 53 87 2171. Airtel Tigo, and I repeat, 49 39 62 18 53 87 2171. So if you get it, kindly let me know in the comment sections, and don't forget to also leave your questions and your suggestions in the comment section. So I just got a text message here which says, most of the time adults send young people to buy them substances. What would you say to such adults? Because Mr. Bisa, most of the documentaries I've watched about addicts, people that abuse substances, some tell you that, okay, so it started when an uncle or someone started sending me to go and buy cigarettes, to go and buy, marijuana and all of that. So what is your thoughts on this?
Yes, so thank you. So on this part, you see, just like you have said, almost for myself as well, most of the documentary I've watched and most of the individuals I've encountered give the story dating back childhood days, and so they thought this was quite interesting, and so they kept repeating this. So for parents who are into this, the reality is that if you want your substance, which we don't encourage, for the fear of that this young one that you have in the house could get used to. And if you really care much about them, then you don't want to involve them. So don't send them. And therefore, the children is difficult because in our African, culture, for instance, it's difficult for a child to say an adult have sent you and you refuse. But I see sometimes it's quite challenging. So for the adult, we say, if you want it, if you think it's good for you, go and have it. Don't involve this innocent and little one. So as you say, go and buy this and come. And then when they buy it, you even go as far as asking them to light it or do something to it. See, that can be quite challenging. But I am saying this also mindful of our culture, our religion, and all that.
Yeah.
That's why I'm not not able to throw a yes or no answer out there.
Yeah.
But at least just cautioning adults, it is something we think that it is not, and we are probably battling. I'm not sure we want to get our younger ones, who are the leaders today and the leaders tomorrow, into this particular challenge. So if you feel you need it, walk and go and buy it, and do it in a way that the child will not even have access to you or see what you are doing.
Okay, so words for families, friends, and about helping someone that is stuck in addiction.
Yes, so there is hope.
Okay.
The hope is that when you have information which we are providing, you can be able to look for the help that is available in our environment, and you can be able to, if you find an institution like what Southside TV is doing, if they don't have the expertise, that is where TOLEC then comes in as an organization of expertise in the area of psychological management of these issues. And there are other organizations also as well. So information like this is meant for us to make a decision. So don't sit there and probably say, oh, there is nothing I can do. You can do something. That information is meant for you to make use of. Make that call today, and you could be linked with the appropriate individuals in terms of professionals, in terms of institutions, to be able to get the help that you want. So there's help available.
Okay, so TOLEC Ghana, where are you located?
Total Life Enhancement Center Ghana, TOLEC, is located on the Tamale Bolga High Street, not rightly behind Garba Lodge, but before you get to Garba Lodge, you take in the IPA route, and we're in the same building with SGS, just adjacent Right to Play building, and that is where we operate from. And so our target being the youth, our target being corporate institutions, and target being individuals who are battling this, especially the youth. The youth, because we think if the youth are well formed today, we'll have a better future. So that when you and I are retiring, there will be some people available to do what we are doing now, to be able to help other individuals in society.
Okay, so I have a comment from Rashid here, and he says, I visited a friend at a rehabilitation center, but I was appalled at the behavior of the social welfare staff. Do you think the social welfare staff have the right skills? I think that is to combat addiction.
You see, individual behavior and professional behavior, probably what he's looking at. Some people have the professional behavior, but they put up some behavior as individuals that doesn't correlate with what they have been taught as professionals. So, and we know that in every institution there, you will not have everybody being perfect. Probably he met one of the wrong ones in the system, but I know a good number of social workers who are doing great jobs. But so if you meet wrong one, you will think that everybody is like that, but I know good ones are in the system. Well, so what we are appealing is that maybe all other individuals who are engaged in services like this, because the services, the service is already stigmatized. So if you then put up a behavior that look disgusting, for lack of a better word, then you'll be pushing people away from accessing your service. Your services should be very friendly, to a sense that somebody comes and doesn't even want to go, or he will go out and he wants to come again. So your service should provide the individual the need to always want to come back. And that is the way you can keep. So that's the connection we need in every rehab center. And that's why I said, I saw a rehab center that looked like a hotel within our jurisdiction. And so it was just because the environment itself was inviting. You go home and you want to go back to this place again because the environment is inviting. So people like that, the person need to work on his behavior because it's not the best. Because if you are doing rehab, you need, I'm not saying just be a pushover and a walkover. You need to be tough to be in the area of rehab. Yeah. I've mentioned they are manipulative.
Yeah.
They will come and ask for things they really do not need and find a way to get what they need because you are just a walkover around them. But sometimes you also need to be aware that people come in and all that they are looking for is to find out whether you have the right skill. But in terms of academic, in terms of professional training, a lot of our social workers have that skill. Sometimes it could be environmental influence. Sometimes they maybe have a different, the person is already also battling his or her personal challenge.
Yeah.
So he brings it. So they are not able to say hang their troubles at home, come and do the work. When you get back, you take it and wear again.
Yeah.
They want to bring it to the works, and that can be challenging. Yes. So that is when they feel to manage their own stress well. Yeah. That stress reflects in the work they do.
Okay. All right. So, Mr. Peter, your final words.
Well, thank you, Southstand TV, for this opportunity. I think when I got a call from the programs manager, I told him this is what I do every day. So if he asked me to come and speak, I just see it as asking me to come and do what I love. Yeah. So I didn't see it to be. I actually appreciated the invitation, and this is what I love to do. Okay. And I believe that the aspect of mental health under which addiction can be found is one of the greatest needs of our time that has been long neglected. So if you are visiting this and you have organizations that are interested in this, they only need to be patted at the back and tell them continue to do that good job. So for us, from the perspective of psychology and from TOLEC, any organization that is in the area of mental health, no matter what you want, we will be there to provide and partner with you to make sure that you reach out to your target audience and they will be satisfied. Thank you.
Okay, so I believe it was Confucius that said, it doesn't matter how slowly you go, so long as you do not stop. So addiction is not something that you should be ashamed of. If you think that you are addicted, get help. Do not be ashamed that your recovery process is not taking the same time as another person. I think we all have our own races. Just keep at yours. Be consistent. Follow whatever is it that the psychologist and the psychiatrist is telling you, and I know that you would get there. So Mr. Peter, a very big thank you to you for taking time off to be with us today, and also a very big thank you to everyone that joined the session today, the comments, the questions. I really appreciate it. Also, a very big thank you to the technical team, Arafat, Abbas, Divine, Adongo, and also our chairman and our boss, Alhaji Rashid Imoro. A very big thank you to all of you. Today I've mentioned your name so that I do not answer a query. A very big thank you to all of you. Without the technical team, there wouldn't be Young Voices Forum. Also, thank you to Savannah Signatures and UNICEF for supporting it. Also, if you need information on combating drug abuse, you can call 5100 on the Ago platform. It is free for users of MTN. When you dial 5100, you can get information on different issues, be it drug addiction, be it every SRH issue. You can get all the information you need there, and it's absolutely free on MTN. You do not need airtime to be able to reach them. The number is 5100, and the beautiful thing about it is that you can actually choose a language that you are comfortable with. So if you want to speak Twi, Dagbani, there are resources available on there that you can benefit from. So you can also try that. So thank you. Until we come your way, same time next week. My name is Rahel Entry, and I was your host for today. Bye-bye.